Okay, we are going to get started now. Good afternoon. My name is Desmond Arias. I am the Marxe Chair of Western Hemisphere Affairs at the Marxe School of Public and International Affairs here at Peru College. I wanted to thank everybody for coming to our event on COVID-19 in the Caribbean. COVID-19 has had marked effects on the Western Hemisphere. As of early November, 5 of the top 10 countries in per capita COVID-19 cases were in the Americas. They included Panama, the United States, Peru, Chile, and Argentina, all of which had between 26,000 and 32,000 cases per million inhabitants. Within the Western Hemisphere, however, the Caribbean has had lower rates of COVID-19 infection, with Trinidad and Tobago having 4,600 per million, Jamaica 3,400 per million, Barbados 901 per million, Haiti 808 per million. The Dominican Republic has had 12,759 cases per million, which is significantly higher than some of the other Caribbean nations, but still far lower than the global and regional leaders. Despite relatively low COVID-19 case rates, the Caribbean has experienced significant economic consequences as a result of the global decline in travel and tourism. This has led to important social challenges as unemployment, hunger, domestic violence have increased, especially among lower income populations. This panel will discuss the scope of COVID-19 in the Caribbean, government strategies to contain the epidemic, and implications for the region's economy and society. Before getting started, I wanted to make sure that I thanked Diana Lazov of the Marxe School for all her work organizing these events over the course of this year, shifting the Marxe Insights events from in-person events to online events with the pandemic. And I'm really grateful for all of her assistance over the several events that I've run on the Western Hemisphere in the last over the last year. I also wanted to thank for their help in helping me think about this event and thinking of people to invite to this event. I wanted to thank Elizabeth Ward at UE Mona, the University of West Indies at Mona. I wanted to thank Karel Samuda, also in Jamaica, and I wanted to thank Lillian Bobia at Bentley College in Boston. We have with us today to discuss these issues three really interesting and knowledgeable speakers. They include first Timothy Johnston, who is the program leader for human development in in the Caribbean and Haiti, which is part of the Latin American and Caribbean region of the World Bank. Mr. Johnston received his bachelor's degree from Yale and his master's degree from the Princeton School of Public and International Affairs. He is the World Bank's human development leader for Caribbean and Haiti. He joined the Latin American Caribbean region in 2018 and relocated to the Haiti country office in September of 2019. He had previously served as a program leader for Southeastern Europe and has wide experience in the World Bank working on health and human development issues, including field assignments in Cambodia and Burkina Faso. Our second participant is Dr. Stanley Lalta, who is a researcher at the Health Economy Unit, Center for Health Economics at the University of West Indies at St. Augustine in Trinidad and Tobago. He has published papers in Global Public Health, Revista Panamericana de Salud Pública, Cadernos de Saúde Pública, Social and Economic Studies, the International Journal of Health Planning and Management, Aging International, and is the editor of a volume entitled Caribbean Economic Development. He received his bachelor's degree at at the University of West Indies, St. Augustine, and graduate degrees at Cambridge University and the London School of Hygiene and Tropical Medicine. Our third speaker today is Therese Turner-Jones. She is the General Manager of the Country Department of the Caribbean, the General Manager of the Country Department Caribbean Group of the Inter-American Development Bank, a national of the Bahamas. Ms. Therese Turner-Jones is the General Manager of the Country Department of the Caribbean, Country Department Caribbean Group, which oversees the Inter-American Development Bank's operations in Barbados, Guyana, Jamaica, Suriname, the Bahamas, and Trinidad and Tobago. She will continue to carry out, she is currently carrying out the functions of country representative in Jamaica also. Ms. Turner-Jones joined the Inter-American Development Bank in 2013 as country representative for Jamaica, and she has 20 years of experience working in macroeconomics and development issues, having worked previously at the at the International Monetary Fund and the Central Bank of the Bahamas. Ms. Turner-Jones is an economist who holds degrees from the University of Toronto and the University of East Anglia in the United Kingdom. And she's the author of a volume entitled Caribbean Renewal, Tackling Fiscal and Debt Issues, which was published by the International Monetary Fund. So welcome to everybody, and thank you to our participants for agreeing to participate and bringing their knowledge to our event here today. I wanted to start out with Ms. Turner-Jones and ask her about the experience of COVID, in particular in Jamaica and Barbados and Guyana.
So thanks so much, Desmond, and it's great to be here with my fellow panelists. And this is such an important topic, especially for your audience, who I think just about everyone has some connection with the region. So it's still an understatement actually to say how COVID-19 has had just compelling and riveting effects throughout this region. Not just because this region is open, these are small island states, with the exception, of course, of Guyana, which is surrounded also by Suriname and with Brazil on one side. But the openness, the smallness, and the immediacy of the sudden stop in travel and tourism has been catastrophic for the Bahamas, for Barbados, for Jamaica, for Tobago, and of course the Eastern Caribbean. And I think there are some folks who may be interested in that as well. So, we're looking at this crisis as one that started off as a health crisis, quickly amplified to an economic crisis. And then, of course, because this region is affected by hurricanes and so on, there's always that underlying threat of climate crisis at the same time. So, it's sort of sad because this region also, given the data you announced at the beginning, managed in the early stages of COVID to protect its populations quite well. So the protocols that were put in place, whether they were lockdowns or restrictions or whatever, this obviously no more flights internationally coming to all of these islands, that had a positive effect in terms of stemming how quickly the virus came through the populations. And so even a country like Barbados today, Barbados has 0 new cases. The Bahamas only yesterday announced 0 new cases. Jamaica new cases have started to taper off. In fact, after the surge in the summer, and there were some specific reasons for the surges, Trinidad, Suriname, Jamaica all had general elections, and we think that caused a bit of a surge, but now things have tapered off. And there is some sense of hope as we turn this corner. However, because these countries depend so heavily on the outside world for economic activity, essentially there's been a collapse in economic activity. And so we have projected that between 5% negative, which is Trinidad, and 15% for the Bahamas, that would be the nature of the fall off in GDP for this year. And sad, I mean, this is equally sad because since the 2008 recession, this region has just started to climb out of that. And we were seeing, for example, in Jamaica, 14 consecutive quarters of economic growth. And now we're sort of set back, I don't know how many years, but significantly. So I think that the first impact is, of course, on welfare. So people on the unemployment rolls, as well as people losing at least one person in a household losing income. Very early on in this crisis in April, the IDB did a quick internet study where we called up over 12,000 households across this region to see how they were faring. And maybe the numbers you mentioned at the beginning too, in terms of impact on lower income folks, because we know that, the lower the quintile you're in, those households happen to suffer worse. And also the impact on women in those households and children. The other aspect of this crisis, I think that is extremely difficult to accept, and I think Timothy may talk a bit more about this, is what's happening with education. So because of the digital divide and because broadband and connectivity is not even across this region, even in a country like Jamaica, 400,000 kids didn't have access to education. So teachers were scrambling, those schools where there was no internet and kids didn't have devices, those teachers were quite creative in doing very interesting things to connect with their students. The government had to react quickly, broadcasting on television, broadcasting on radio, putting curricula inside the newspapers. So I think the reactions and the policy responses of these governments have been quite creative, interesting, innovative, but not sufficient for someone like me to worry about the long-term impact. So I could stop here and hear from the others, and then we can take some more questions later. But I would say the biggest impact so far has been the economic one. I think the health crisis we're dealing with, everyone's looking forward to having the vaccine. But I think how we crawl out of this recovery is going to be extremely difficult. And looking ahead, I think one of the avenues, of course, is looking towards a green recovery. So investments in renewable energy and also anything that can be done on a digital platform. And I guess if there is one positive of this crisis, it's been how quickly, not just governments, but also the private sector has adapted to moving to digital platforms. So I think that's the good story here. And of course, everybody has a story to tell about some new business that they're now doing digitally and how that's helped us as we're locked away in our homes. Thank you.
So I wanted to turn now to Timothy and Mr. Johnston and ask him, what his perspective is of the effect of COVID-19 on the region, and given the focus of his work, maybe speak a little bit specifically to the experience of Haiti and the Dominican Republic.
Sure. Thank you very much, and also thank you for the invitation and for all the participants for joining. It's a great opportunity to share experiences and get your questions as well. Yeah. I think Therese gave a very good overview of the broad picture. At the World Bank, our Caribbean department covers all the independent states of the Caribbean, including some that are higher income that are non-borrowers, but they're still members of the World Bank group, even though we're not necessarily active there. So as we just said, what you're seeing in terms of the economic impact, most countries are having a decline of GDP between 5% up to 15% in the case of the Eastern Caribbean states that are small and very dependent on tourism. And at the same time, you see a real variation in terms of the health impact. For the most part, as you said, the countries have kept the COVID epidemic under control in terms of the number of cases. One exception is the Dominican Republic, which interestingly, of course, is right next to Haiti with a whole lot of cross-border migration. And I think there's probably a variety of reasons why the DR was hit harder. There's a lot of tourism from Europe. I was actually there in March with my family and sharing a lot of French, a lot of Italian. And so you have a lot of influx of tourists from some of these European states, which probably seeded the epidemic in a number of places. And so a lot more, and probably more indoor life in terms of air conditioning. I mean, what's interesting is next door in Haiti, for reasons we don't fully understand, the epidemic has not been as bad. Similar to what you see in some African countries, where there's certainly some impacts, but not nearly as much as we expected, although there still is some transmission going on now. But there has been said, the biggest impact on the countries has been on tourism and the economy, even as they've needed to strengthen their core public health systems, both in terms of responding to the pandemic, preparing for a vaccine, and then preparing to come back from this. In terms of the overall response, we've seen it in different pieces. One, of course, is the immediate health response. The second is the response in terms of livelihoods, because you have people losing jobs both in the formal sector, some of whom have qualified for unemployment insurance or other mechanisms, but you have a lot of people losing livelihoods in the informal sector, for which very few of our countries had any real safety net mechanism. And then you have people that were near poverty that are being pushed into poverty, but aren't currently covered by the safety nets. So the other part of the national response has been a very strong response with respect to addressing poverty and livelihoods. A number of countries have approved on an exceptional basis new transfer programs to get support to households or families that have lost jobs. And so they've been both deepening their existing social safety nets to provide some additional support to the poor that are already included in cash transfer programs or otherwise. And this is true of many of the countries, whether it's the DR, Jamaica, Belize, elsewhere. And then also adding these new programs on an exceptional basis to provide support to households that don't normally qualify for safety nets. An interesting dimension, though, is that it seems, because the region is so dependent on remittances, the fact that the US had this very generous transfer program with the $600, we were surprised that the remittances fell much less than we expected, for example, in Haiti. Perhaps because some of the family members working in the US were getting some additional income support. So there wasn't quite the impact that we might have expected. The third part is in supporting jobs, particularly small, medium enterprises have been hit very hard. So a number of countries have set up special programs to provide exceptional support to small and medium enterprises so the businesses don't go bankrupt, and usually this is conditioned on preserving jobs in some way. And I think both we and the IDB and others have been supporting some of these programs. And then there's the overall issue of working with countries on a resilient recovery. And that has a fiscal element, because the COVID has also had, a lot of the countries are moving toward consolidating their debt, since a lot of the countries were very debt distressed. They were making some real progress. Jamaica is very notable in this respect, but so are many of the other countries. And COVID has set them back somewhat. So there's been a lot of high-level dialogue with the international community on debt forgiveness, on greater flexibility and debt repayment to help the countries get through this. And then, of course, looking forward, there'll be, and we can get to this in the further discussion, there's the immediate issue of how to roll out vaccines, which will really help the countries get back on their feet in terms of the tourism and the economy, and then the broader agenda of resilient recovery, which may include taking advantage of some new opportunities to be less dependent on tourism, take advantage of digital aspects, and create new growth opportunities as they move forward. Thanks.
So I wanted to just briefly follow up with you, Timothy, on the question of Haiti. One issue that I wonder, given its low COVID infection rates, is if testing's keeping up there. Do you think that some of that low rate is due to lower rates of testing, or is it really just that they have a surprisingly low rate of COVID?
Yeah, obviously the testing coverage is less than in some countries, but the actual case reporting includes both suspected cases as well as confirmed cases. The data isn't great there. There's other aspects. We definitely saw a surge at the early stages of the epidemic with additional people getting sick, or even checking some areas where there was additional deaths beyond that weren't confirmed. So there clearly was an impact early on, but the level of hospitalization that we expected, it never got anywhere near that. Now, exactly what's happening, to be perfectly honest, we're not sure. We're still waiting for the first population level prevalence data, seroprevalence, to see what, it's possible that a lot of people got exposed early at a low level and developed some resistance. It's possible there's some cross immunity. For example, there may be some evidence that if you've had dengue or if you've had a tuberculosis shot or some other things that maybe that reduces the infection. And life is a little more outdoors there. Even in contrast to DR, where there's a lot more air conditioning and people gathering inside. But to be perfectly honest, we don't know. So we have to be cautious, and there's a worry now there may be a resurgence now, particularly with people coming back from the US, particularly like around Pétionville, Port-au-Prince, and some of the more urban, better off areas. But we have to say that this is a very new epidemic. There's a lot we don't know. We're not sure why it hasn't hit some African countries as hard. We're not sure why it hasn't hit Haiti as hard. But it doesn't mean it can't come back, and it doesn't mean we don't have to be very careful. At the same time, there was clearly an impact on the health system as a whole. You saw a sharp drop in women coming in to deliver babies because there's a lot of worry and suspicion at first about the epidemic. And so it clearly had a huge impact on the economy, although Haiti's coming out of a lot of crisis. We've been on lockdown with unrest since last year. So the COVID in the Haiti case was just a continuation of what's been a series of crises in the last year. So it's somewhat of a continuation of what we were experiencing before. Thanks.
Okay, great. And I wanted to ask Dr. Lalta now, what's been the experience with COVID in Trinidad and Tobago, Belize, and the Dutch-speaking islands? We can't hear you, Stanley.
My error. Thank you very much, Desmond. Thank you very much to the school for inviting us to participate in this webinar. It's been quite a mixed experience in the countries that you have mentioned, and in fact, in all the Caribbean countries. What strikes you when you look at the whole sweep from the Bahamas in the north, come all the way down to Guyana in the south, French Guyana, Suriname, stretch into Belize and Central America, come down to the Dutch-speaking countries, the French-speaking islands, Martinique, Guadeloupe. You look at the figures and some of them turn out to be quite surprising. Some very, what we call high cases for us in the Caribbean, and some rather low cases, like 22 cases in St. Kitts looked like on the low side. 7 cases in Anguilla, a small country, looks very much on the low side. Compared to the Bahamas, Jamaica, and so population size is one factor, but also the whole matter of public health measures. And to an extent, I think what has been happening is that Caribbean countries are now reaching the limits of non-vaccine public health management. How much can you shut down the economies? How much can you shut down schools? How much can you ask people to stay at home, to give up a whole lot of activities which may be called culturally relevant for persons, going to churches, funerals, and all of these things. So what we've had to do in most of these countries is really to come out very strongly in terms of public health legislation. Public health legislation, which tried very much to bring in the whole matter of enforced adherence or compliance, and that in itself posed a lot of consequences, human rights and all the other matters which come into the mix. But literally, in the absence of a vaccine, you have to rely on the proven public health measures, testing, isolation, getting people to follow the regulations, and to an extent, persons are reaching the limit in terms of those, and that's one of the things. The public health system, and I have to admit that the public health systems in most of the Caribbean countries have stood up to the test. They have responded, governments have put in extra money into the system. And even though you do have a fairly large private health system, it's the public health system literally that has been taking charge of the response. So to that extent, we think that the public health system has responded. There's been the stresses and the strains. Bahamas close to the edge, Guyana close to the edge. All countries have had to establish parallel health facilities, parallel health systems, get hotels into the mix to cater to persons who needed to be isolated or quarantined and all of those. So there's been adjustment, but going forward, we must now look at how we strengthen the public, but also how we bring that private sector more and more into the mix. And that's going to be part of the response that we want to look at in the months ahead.
So I wanted to follow up with you, Dr. Lalta, and ask you if you could tell us some more about these public health responses. What have been the types of strategies that governments in the region have used that have been successful in helping to control COVID?
Well, and I think Therese would have introduced some of these already. If you start at the top, the whole matter of border closure. For the Caribbean, that has been the toughest one. The toughest one literally because of the large tourist population that we need, both cruise ship and by air. And to shut your borders literally mean that you're closing off a significant chunk of your economy. It also meant having to tell your people living abroad, residents and citizens living abroad, that we can't easily accommodate you. And that has been problematic in many respects. And I do expect that with the opening up of the borders, and especially around Christmas time, when lots of citizens abroad return home, that come mid-January, the latter part of January, we will begin to see some kind of impact from all of that. So what we do with the borders become very important. What we've done with the economy, I think both Tim and Therese have mentioned, governments have tried to put together fiscal stimulus packages. They've tried to put in place social mitigation measures. They've tried to get the banks, the commercial banks, to join into the mix by deferring loan payments. Governments themselves have been looking outwards to try to get additional support, both from the multilaterals as well as from other sources. So that's been a short-term kind of measure, which has additionally meant public debt problems that we're likely to incur. Education and schooling has been affected. Labor, the population, many persons, because of the downturn in the tourist economy, in the retail trade, etc., restaurant. There's been a major turnaround on employment, underemployment, and all of these have been measures, have been sectors, have been instances where the governments have tried to step in and make provisions. For me, literally, the very big one has been what the government has tried to do with public health restrictions, legislation, regulations to limit the movement of people, to charge people, to penalize persons for breaking the rules. And this is where the role of the police, the role of the security forces, has become very significant in trying to help the health sector in managing the public health impact of COVID.
Thank you. And now I wanted to turn to Ms. Turner-Jones and ask her the same question, the role of governments in imposing public health measures and strategies to control COVID in the region, but also to keep the economy sort of moving. Jamaica in particular adopted an innovative approach where tourists were allowed to return to a certain portion of the north coast of the island, but then the rest of the island was sort of reserved for domestic traffic only. And I wondered if you could explore that a little bit.
Sure. So what we've seen is what I call a mixed bag of restrictions. So up up to now, Trinidad still is not allowing international or very few international flights into Port of Spain, whereas Jamaica never really, well, at the beginning, there were very few flights. Bahamas, very few flights. All of these countries have some sort of quarantine measure in place. So you arrive in Jamaica, whether you're a resident or a foreigner, and I'll get to the tourists, the resilient corridor. So if you arrive in Montego Bay and you're just going to a resort, you weren't required to quarantine, but you were asked to download an app on your phone, and you could not go outside of that resilient corridor. So I think that's helped. And in fact, the Ministry of Tourism claims that there has been not a single case of COVID linked to a visitor, a foreign visitor. So, and I say foreign visitor as opposed to returning residents, because I think the surge we saw in the summer had a lot to do with returning residents who did not, in fact, follow the quarantine guidelines, and they were all about the place and so on. So that's Jamaica. Bahamas, very strict quarantining, even inter-island. So just yesterday, the Prime Minister of Bahamas announced that now you don't need you won't be required to quarantine if you wanted to go from New Providence to Eleuthera, for example. So they've relaxed some of those regulations quite a bit. I think one of the more effective policies, though, has been in the event that they found a community cluster, they basically cordoned off that community. So no people could go in, no people could come out. And that was quite effective in the early days of keeping people essentially, you know, if you're from this region and your region was affected, you couldn't leave. And they used the police forces to monitor that. I think when community spread started to happen in Jamaica in the middle of the summer, well, that went sort of out the door. And now they're more stringent quarantining in place in Jamaica. So anybody traveling from the US into Jamaica now, even if you're a returning resident, you're quarantined, you have an app downloaded on your phone, you are being monitored. Although some people wonder about this monitoring because, you know, I have my own personal example. My daughter arrived in the middle of November. She was given a form to fill out. Her temperature must be measured twice a day, every 12 hours. Somebody would call her to get the information. Well, over 2 weeks, her quarantine period, we did not receive one phone call. But that's not to say others haven't gotten phone calls. So I think it's been mixed, but it's been fairly effective. Now, in terms of social support, Jonathan mentioned quite a few. Jamaica still has in effect what it's called its care package, which is over 600,000 households and private small businesses are receiving some kind of support from the government. Obviously, a country like Jamaica that had built up a lot of fiscal buffers over the last few years was in a good position to do that. Bahamas and Barbados, for example, very quickly ran up against the unemployment insurance sort of maximum that they could issue before it started to have some impact on their budgets. Obviously, it's having a fiscal impact everywhere because revenues are declining and the government spending more money. But I think that has been an important aspect for keeping social cohesion and making sure that all hell doesn't break loose in these countries. The next few months, I think, are going to be very, very trying, not only because, as I mentioned, fiscal constraints are coming very hard up onto every single finance ministry, but also, you know, fourth quarter of the year, first quarter of the year, these are the two peak tourism periods. And obviously there is nothing like a peak season going on anywhere throughout the region. So it's going to be difficult, and these governments have to make difficult choices. Stanley mentioned that the IDB and the World Bank have been providing support to governments in health, as well as social support and other fiscal policy-based loans to help out in this period. And that's been very helpful, along with the IMF as well. So rapid financing access, some of these countries have gotten. And I think that will continue to be the story well into 21, because we do not see any turnaround in the economic situation anytime soon, given that absent a vaccine, and we all know the issues around the vaccine, while all of the countries have made a down payment for X percentage of their population to be covered under the COVAX facility, you know, when it actually hits Jamaica or Bahamas or Barbados or wherever, you know, that's, we don't know. I mean, in the UK, the vaccine is being rolled out this week, but in the US, it could probably take another few weeks and maybe months before it's rolled out fully in across the American population. And even there, I mean, the story is, will Americans who will have access to the vaccine actually take the vaccine? So that's another question I think that needs to be analyzed more closely. But I think from where I sit, I don't see returning to any kind of normal before 22, 23 for this region. It's going to be a bumpy ride.
And I wanted to take this same question to Mr. Johnson. Mr. Johnston, can you tell us about sort of particular government responses that have been helpful in addressing the spread of COVID in Haiti, the Dominican Republic, or other countries in the region?
Sure. Yeah, and I think it's good to get the overall perspective on the response. You know, when the lockdown started around March, the virus had only been even discovered a few months earlier. So there was actually very little we knew about the virus, how to prevent it, how the effects would be. And so the immediate response was critical. And the lockdowns were essentially trying to buy time. And that included giving, and it was most effective in these countries because since they're islands, once you lock down, if you don't have many cases, you can avoid some degree of community spread, although obviously some difference between some of the smaller islands and the bigger ones. So with the lockdown, then the immediate focus was on one, strengthening the core surveillance systems. A lot of these countries didn't even have capacity to do PCR testing in-house. You know, the small islands were often sending to the CARFA lab for tests. So they needed to ramp up testing capacity. They needed to get protective equipment and even get some ventilators in, because again, they didn't know what the burden would be. They needed to strengthen their overall systems for the response. And then what we know about public health responses in general is that a lot of public health responses, such as contact tracing, isolating clusters, it works well at the beginning and the end of an epidemic. Once you're in a generalized epidemic, like frankly in the US right now, the contact tracing is completely broken down because there's so many cases. And so for the island states, I would agree that a lot of them had, with some variation, already strong public health systems in place. We were already working with several of the OECS countries on strengthening their core public health and surveillance systems. So we were able to build on that, as the epidemic came out. I think the other thing we didn't know at first was we had no idea whether wearing masks, like a cloth mask, would actually reduce transmission. Now it turns out it does. It doesn't eliminate it, but the evidence increasingly is that if you wear a mask, if you social distance, 6 feet or so, if you avoid poorly ventilated indoor spaces with large groups, do as much as you can outside, you can significantly reduce transmission. And so that the combination of sticking with these core public health guidelines, if people will adhere to them, and they've been undermined in the US because of this lack of public trust and expertise, I think frankly, the Caribbean has done much better on that. And there's been some very good leadership and messaging from the leaders on the need to continue to implement these measures. Because I think the issue on fatigue is very real. I mean, the countries really need to start reopening their economies as much as they can, even if they are doing it slowly. I think Jamaica is a very good example of taking a very targeted approach based on public health guidelines and evidence to doing that very carefully with good monitoring. And then moving forward for being as cautious as they can as they do the reopening. We can touch on the vaccine aspects. I think that is going to be critical to really return to normal. The practical issue right now is you've got 2 international vaccines that are starting to receive approval. This is the Moderna and the Pfizer vaccines. These are both new technologies. They're called mRNA vaccines. that require very super cold chain, it's called. They have to be very cold, -30 to -70 degrees. Very few countries have capacity for this, and these vaccines aren't even included in the COVAX mechanism, which we can come back to later. But there are other vaccines that are in late stage trials. The AstraZeneca one had some early data announced. There's a Johnson & Johnson vaccines that are kind of normal vaccines, viral vectors or others that just require normal cold chain. But it's going to take a little more time to roll these out. So I think the reality is that it's going to be toward the end of next year before you start getting significant coverage, though hopefully you'll start getting some initial supplies coming into the Caribbean in 2021. Though, as was said, we don't know the exact timing right now. I think we can come back to the details on that later. But I think for the health response, it is going to be this combination of continuing to implement evidence-based policies, keeping the public messaging clear, recognizing that people are tired and want to get back to their families and their jobs. Yeah, I think maintaining that leadership and the focus on the response is very important. Thanks.
Okay, and I think this is probably a good moment, given that we have about 15 minutes before the, question and answer period. So if anybody in the audience would like to ask questions, please send those questions to the chat box, and then I will sort through them and ask them and put them to the panel in about 15 or 20 minutes, depending on how we move through the next set of questions. But I think this is actually a really good moment, given where you went with this, Tim, is to talk about the vaccine, the prospect of the vaccine in the Caribbean, and the challenges that the region is going to face in distributing the vaccine over its entire population.
Should I comment briefly and then turn over to the other panels?
So yeah, I was going to. I'm kind of like, yes, you were last in the previous set of questions, so I'm coming back to you first in this question, and then I'm going to go through the rest of the panel.
Thanks. And then I'll start with that. I'll just briefly mention. I realize I didn't pick up on the point that Therese made on education, but maybe we can come back to that later, because that clearly is a big issue, and I think the digital divide and the risk of the lower income students falling behind further is a real concern. So let's come back to that, but. On vaccines, so I think maybe not everyone in the audience knows how the COVAX facility works. So I could briefly explain that, and then we can come to some of the practical matters. So the concern on the vaccine is like the concerns we had on the protective equipment, the PPEs, and that even when there's financing, the global supply has a real shortage, and that shortage constraint is even of a greater concern for the vaccines. So there's been record progress in developing these vaccines. The early data is better than we expected in terms of the efficacy. But there's only so much production these companies can ramp up. So you have two major players that are doing these novel type of vaccines that have gotten preliminary approval. There's a number of others in the pipeline. And what's happened with the COVAX facility is there is a concern that the wealthy countries would lock in the entire supply, which has happened to a large degree. But the COVAX facility basically is kind of a buyer's club, where it's run by Gavi, the Global Alliance on Vaccines, together with WHO, and a number of different international partners are part of it. The World Bank's a non-voting member. But the idea is to bring together the lower income countries, middle and upper middle income countries into kind of a pool. And they will commit that they want a certain access to vaccines. And then the companies also commit to provide a certain amount of their supply to this collective, not knowing which vaccines are going to be approved first. So it's trying to be a flexible mechanism to deal with this basic market problem and uncertainties. And it has an overall governance arrangement. There's a mechanism also that for the lower income countries up to a certain threshold, for the World Bank, it's those that qualify for our concessional window, though it's not exactly corresponded, but it includes 4 of the Eastern Caribbean countries and Haiti, that they will get subsidized access up to about, they were hoping for 20% of the population, but right now they have enough money for about 16%. And then the other countries can buy into a certain coverage. They can also try to purchase directly with the companies or seek financing for the World Bank or the IDB or others to help them access that supply. So there's a big issue on access. But I think the other point to emphasize is that we call this shift from vaccines to vaccination. The implementation of the vaccines is going to be challenging. And so there's a process right now led by WHO or PAHO to do country diagnostics of all the key things that they have to do to implement vaccination. So they're doing these diagnostic instruments now. We hope to have results soon, in a couple of weeks or sooner. That will include costing the response. They are also then developing what they call deployment plans on how will they roll out this vaccine. And that's everything from who are the priority populations, medical staff, vulnerable, who will be prioritized? How will you do the follow-up if it's a 2-dose vaccine? How will the logistics work? Do you need to strengthen your cold chain capacity? Do you need to strengthen distribution? Information, how do you get, if there is concern about people taking the vaccination, what will be your information campaign, your outreach? You need pharmacological surveillance. And so there's all these elements that have to be brought together for this to work. And so the effort will be to try to put all these pieces together and help the countries roll this out as quickly as they can. And of course, this collaboration among all the partners and the civil society and the governments is going to be critical. Thanks.
And Stanley, I wanted to ask you about how you see the challenges of rolling out the vaccine in the Caribbean, and in particular the countries where you have greatest expertise.
Well, Tim has put the matter very, very nicely on the table, because it's not just the vaccine one is looking at the process of vaccination. And I think I saw some data a couple of weeks ago where if you look at the total package, the vaccine cost itself maybe about 85%, but you still have to get the syringes, you have to get the vials, you have to get the cold storage, the transport to facilities, to train people, and all of that. So that is going to take, as you said, some effort, the deployment measures. One of the critical things which will come up is where does the private sector fit into all of this? Because remember, a lot of this is being thought of as being rolled out within the public sector, public hospitals, public clinics, for example. Will the private sector, will private doctors, private facilities be brought into the mix to get into some of the vaccination? And is that going to be at a cost? And how is that cost going to be borne? Because very, very clearly, if you want to get your target population first and then the overall population, you can't only think public sector. And that's a matter which will have to be borne in mind. Tim brought it up, but I think we need to spend a bit more time looking at the whole matter of how do you keep track of all of this? Your MIS IT system. MIS IT system to track first dose, second dose, are they on time, who's getting them, any adverse effects not being fed back, even to work backwards to do the tracking of the stock, the management of the stock of vaccine that you get. So literally, you are going to be calling for a major investment on the MIS IT side in order to get all of this going. So I'm beginning to put all of these into the mix so that when we begin to think through these in the next stage, or even from now, that we can bring all of these on the table. Of course, the capacity for doing this varies across the Caribbean countries. In some, for example, some of the English-speaking countries which have a very strong public health background, especially where immunization, EPI, and so are concerned, they do have systems in place. For example, in many of the English-speaking countries, if your child is not immunized, you can't show up in school. I don't think that that's going to be flying in many of the other places. So that's something which one will have to look at. And I think that Therese brought up the point about vaccines may be available. You may have your target groups, but what about the public acceptance? What about the public confidence, public trust? So that to me is also going to be a major factor. And to an extent, we have to approach this beyond just the public sector. One would have to look at it as a whole of government, whole of society approach, and like how the countries approach HIV. It was not restricted only to public sector operations. You have to get the NGOs involved. You have to get the employer organizations involved, the rest of society involved, so that if we don't do that, then I think we're going to fall by the wayside.
And so I wanted to bring this question finally to Therese, and to also ask, not just about the role, efforts to distribute the vaccine and challenges that the regions may face, but also about the role of multilateral organizations in helping, especially the smaller countries, in distributing and making the vaccine accessible.
Yes, thanks. So I think Timothy outlined the general landscape, and Stanley talked about in the Caribbean, there's a culture of vaccination, which I think is certainly healthier than what pertains in the US, which is, there's no anti-vaxxer movement in the Caribbean that I know of. Most parents want to make sure their children are immunized because there are regulations about going to school and so on, and you have to have it. And there's just not the same hysteria. And certainly, even though, if you take the African-American sort of hang-ups with vaccines, especially Black men in the United States having that terrible experience with the Tuskegee experiment, and I think that's come up again in the dialogue as to whether you can attract African Americans to take this vaccine. I think in the Caribbean, it's very different. I think we have a different culture related to vaccines. I think most people who are rational want a vaccination if it's going to help. I mean, I'm hearing some people, even in my circle, say, well, I don't want to be the first one to take it, but of course I'm looking forward to the vaccine because everybody's sort of wanting to get on with life. The IDB is participating in the COVAX facility to the extent that we're helping the countries make sure in the first round that they made the down payment in time and they were aware of what was necessary. So we help with that. We've also offered, if they need financial assistance, that we would help to pay for them. COPFA and PAHO have been extremely helpful throughout. I think the reason why this region has done really well is that all of the ministries of health were listening to PAHO and the WHO guidelines, with PAHO being the sort of fulcrum, because PAHO has representatives in almost all these countries. And working with COPFA, which is the regional health facility in Trinidad and Tobago, a lot of harmonization of these approaches, guidelines, restrictions, whatever you want to call it, was sort of done in that way. And I think that's been extremely helpful. I don't worry too much that even a country like Jamaica will be able to roll out these vaccines, because I think I keep forgetting which bit it's Pfizer helping with the Oxford one, but the one that's coming out this week, that one doesn't need special cold storage. It's basically refrigeration, which all these facilities around the region already have for dispensing vaccines. So it could be easier than we think. What I'm seeing, and I think it's super helpful, is that governments are already forming their commissions, or whatever they're calling it, to talk about who will get it first. Like, I was very interested to hear this morning that in the UK, you have to be over 80 and in a care home and working as a healthcare professional to have the first access to those vaccines that they're starting this week. So each country will have to do that. What's your most vulnerable population after you take care of the healthcare professionals, and decide how it's going to be rolled out. But I think I'm not so worried that Caribbean people are going to scoff at it and say, I don't want to be vaccinated. I think people realize that this is a rational approach to something like a pandemic. And if a vaccine can help, and if it's proven that it's effective, I think people will do it. And Caribbean people want to get on with their lives. So I think that's the positive side. I would agree, though, that some health systems, and Stanley mentioned the whole IT systems, are not quite ready. In Jamaica, we're at the sort of embryonic stages of working on their health information system. We have a long way to go to digitizing health records in the Caribbean. It's happening in some countries, but it's not systematic across the region. And I think that's an area that needs a lot of work. But I think we can get this done with the same efficacy that we've gotten, the CPR test, the PCR testing done up to now, and the way that our health systems have managed up to now and kept most people alive. I mean, if you look at the amount of deaths in our region relative to any even a city in anywhere in the United States, we're still doing much better. So we're doing something right here. Thank you.
Thank you. So before we move into the question and answer period, I wanted to put one last question to the three panelists. And I wanted to start with you, Stanley, and ask, so we've got the vaccine coming, but a lot of damage has already been done to the economies in the region. And, you know, in the focusing on the areas you know best, I wanted to ask, you know, what you see happening over the next 6 months and year to economy and society in the Caribbean and the challenges that people are going to face.
Desmond, I think we will continue to see a lot of hardship. If the tourist economy does not open up, then we will have a lot of difficulties. There's a limit to what governments can do now in terms of their fiscal package.
No.
And if the tourist economy doesn't open, we'll have problems. A related aspect of that is what's been happening with remittances. Remember, you do have a big group of Caribbean citizens who live abroad. I think the data which I've seen coming out from Jamaica is that remittances have been, you know, holding their own. There's been some decline, I would think, from compared to last year, which was a big year, or 2018, but remittances have been holding their own. We can't say the same about some of the other countries because we do know that Caribbean populations in the US and Canada, in the European countries have been badly affected by the downturn in those economies, so that we do expect that there will be some problems there. Of course, the example of Cuba is even more extreme, with Western Union being shut out from Cuba. So that's a factor which has to be borne in mind. Another related factor in all of this is the availability of soft funding. Remember, most of the Caribbean countries, with the exception of Haiti and probably to an extent Guyana, and that may not be for very long, in the case of Guyana, are considered as high-income countries. Therefore, your eligibility for soft funding is very much reduced. And many of these countries already, you know, have fairly high debt levels, public debt levels. In fact, with COVID, I expect that some of these debt levels would cross 100% or more of GDP again. So because of your high income status, that poses particular challenges for these countries in trying to get access from the multilaterals as well as from the commercial system. Alongside with that, of course, with the commercial system, you do have the matter of your credit rating. Your credit rating is tied to many factors, and many countries have suffered a downturn in their credit rating, so that access to commercial financing will become very problematic too. So I do see on that very broad front that there'll be some continuation of the hardship at the ground level in terms of businesses, you know, retail trade, in terms of manufacturing, because the buying power in the community, the buying power in some of the importing countries has been reduced, then we do expect that some of these problems will persist. So very bluntly, for the first 6 months or so, I would think that the Caribbean countries will continue to face some of the hardships that we are currently facing, both on the economy side, as well in terms of the social mitigation strategies.
And I wanted to put this question to Therese also. What do you see as the prospects for the region in the next year?
So I think the word I've been using all year is grim, just because of, you know, the hard stop in tourism and travel. I think that makes it very difficult for Bahamas, Jamaica, Barbados, again, Tobago, the Eastern Caribbean countries that are so heavily dependent on foreign exchange from tourism. So I think it's complicated. I think we're going to see higher debt levels because there's no way out of this. I mean, like every other economy around the globe, I mean, the debt levels are rising, and that's going to have problems down the road. As Stanley mentioned, debt levels are already high on average in this region. But I think this is not the time to sort of really fixate on a debt to GDP ratio right now. I think this is the time to really look hard at public expenditures to make sure that what governments are spending money on, that's really high value and high impact. So whether it's delivering services directly to the most vulnerable parts of the population, putting cash in the hands of people. Timothy will tell you, I mean, we know that cash transfers tend to have biggest impact on lower income people in particular. The money into their hands gets spent, they buy food, they pay for education, they pay for health services. Boom, you've got a bit of money circulating in the economy. I see, I see a difficult period ahead, and I think countries in the Caribbean are going to have to dig quite deep to think through their partnerships, who they're collaborating with, how much can they extract from the IDB, how much can they extract from the World Bank, how much they can keep extracting from the IMF. Are there any other bilateral partners that they have that they can draw on now to help do some specific work, whether it's in education or whether it's in, looking after the social needs of the poor. Women who are looking after children who are falling out of the workforce. We're seeing labor participation rates, for example, in our region fall, not just for women, but also men. What's behind that? And where women are falling out of the labor force because they've got to simultaneously try to keep things together at home and oversee children's home schooling, that's some support that women are going to need. And until things normalize again, is there anything we can do to help those families? Giving a laptop to a kid is not the answer, because a laptop minus supervision and minus a teacher who knows how to teach online is also a complication. So I think, as some people are saying for Jamaica, we're really afraid of what's happening to students this year, and it's going to have a long-term impact. So I think these are going to have serious consequences later on for productivity and so on. I think we just have to be very clever about where we invest and what we invest in, and make sure that the government makes good decisions about their spending. Thanks.
And Tim, I wanted to put that question to you also. What do you see as the prospects for the region, and in particular Haiti and the Dominican Republic in the coming year?
Yeah, I think a lot of the big issues have been touched on. I think, as has been said, the coming months are going to remain challenging, since it will take some time to roll out a vaccine. There will be a balancing act between this high-level discussions for the countries trying to maintain some kind of fiscal balance and keep their debt under control, both with some flexibility on the repayment side, and there's quite a lot of high-level dialogue going on about how to manage the debt and fiscal situation. I should note that for the World Bank, in terms of the access to finance, we have kind of several levels. It operates somewhat like a credit union, with the very poorest countries like Haiti or those that are emerging from conflict have access to grants that is financed by donors. Then the other countries, that includes in our region, Guyana, for the OECS countries like Dominica, Grenada, St. Lucia, St. Vincent and Grenadines, have access to what we call our IDA window, which is very soft loans. So it's 0% interest, 40 years repayment. So it's mostly grant and requires financing from donors. And then the upper middle income countries have access to very low interest loans that's often below market rates, that then has extended repayment periods. And then countries that get into high income status are considered graduates. And so they are still members of the World Bank Group, but don't normally access financing. There's already been an exception made to that, in that budget support loans have been approved for Bahamas and Barbados on exceptional basis to help them through this crisis. And so there is some of this higher level dialogue going on in terms of how to create as much flexibility, with a particular interest to these small states, because they do face particular vulnerabilities. And so there is already some flexibility. So for example, these small states and the OECS get access to 3 times as much IDA as they normally would based on population. So there already is a dialogue on small states within the international community and the World Bank that tries to give some flexibility here, but it's an ongoing concern for the governments and the prime ministers. And Now, in terms of moving ahead, I think a lot of the key issues have been touched on. Within the budget availability, some of these basic transfers to keep poor households and businesses going may be necessary. That's going to have some costs, though. Education is a particular challenge. There's been a lot of learning on how to use educational technology more effectively, but it really has raised the importance of these things about broadband, the digital divide, broadband access. And I think a key message and an important opportunity has been the countries have advanced a lot on how to do these things. We know in terms of education that just giving a laptop, just giving an iPad to students has no impact whatsoever on learning. It has to be brought together with other measures, including software on how they can learn. It's actually quite effective on math. You have to train the teachers. And of course, the availability of parents to help out is a key factor. So if the parents are having to work all the time or are otherwise occupied, that's more difficult. So there's a lot to be done there. I think if we can get kids back in school with the right protective measures, that's going to be important. And there's a lot of international efforts and guidance to give advice to countries on how to do this effectively and safely. And then try to restart the economies as much as they can. In terms of the prospects for 2021, there's different projections out there. A lot of it depends on what you assume will happen with tourism, because that's such a big driver. And depending what you assume on the tourism recovery, you have different scenarios on how the economies will do. But happy to take more questions in the follow-up. And I should note, I haven't really talked a lot specifically about the World Bank's response on these things, but can take questions on that if that's of interest. Thanks.
Great, thank you so much. And we've had a bunch of questions come in already. And I guess one question that came in is the role of specific donor countries in the region. One of our participants asks about the role of, actually two of our participants asked about the role of China in vaccine distribution and response. But I also want to, and well, I think China is an interesting question in terms of that country's growing involvement in the Western Hemisphere generally. I didn't want to leave out the other important donor nations in the Caribbean, which in my experience are Canada, the US, the UK, and France. And I guess the Netherlands also came up in our in our discussion before we went live with the participants. Therese, do you want to start this out?
Sure. So far, China hasn't come up in the context of vaccine distribution that I'm aware of in Jamaica or anywhere else in the region. But of course, China is a big player in financing infrastructure in the Caribbean. Jamaica, for example, all the road works are being funded by China, and Jamaica is not unique there. I mean, they've been doing a lot of infrastructure works all over this region for some time. So I think China continues to be a big player. I'm just going to leave it at that. Yes. Other bilaterals, of course, are important. Other relationships are very important. We saw in the early days of the pandemic, European Union, Canada, the UK, either field hospitals or PPE equipment or ventilators. I mean, those relationships are very strong with the Caribbean, and they continue to be strong. And I think those partners continue to do their bits. So I think, and they remain very important partners for just about every single country in this region. So I see that continuing.
And Tim, before we did go live, you had mentioned that the Netherlands has been, I guess, involved in some additional direct assistance that I believe you might be mediating. And I was wondering if you could speak to that.
Sure. I mean, very briefly, there's been a big focus on resilience and risk management in the region. And of course, with pre-COVID, we're focusing mostly on hurricanes and those types of disasters, hurricanes, floods. So, of course, St. Martin got hit very hard by a hurricane 2 years ago. And even though they are a high-income country and not even a member of the World Bank Group, we have a partnership with the Netherlands where the World Bank's been provided financing through a trust fund to support the reconstruction of St. Martin. So it's sort of a tripartite arrangement between the Netherlands, the World Bank, and the government of St. Martin on rebuilding, and includes everything from housing, reconstruction to fixing and then building a new hospital, new airport, so a whole range of activities. So it's unusual. It's the first time the World Bank's done any work in a high-income country, project work. But it's an unusual arrangement, but also because of the concern in the Caribbean on this issue of with climate change and other factors, this issue of resilience is critical for the region, whether it's pandemic resilience, fiscal resilience, or resilience to climate change.
We had another question come in just now about the role of civil society organizations, and I wanted to put this question to Stanley, both in terms of because he's raised this issue, I believe, twice. What do you think in the coming months is the role of civil society in the private sector in helping the region address the crisis, the healthcare and economic crisis that it's facing?
I think that's a major role which we have not paid very much attention to so far in managing COVID, to how we bring in the non-governmental organizations and the private sector into the mix. But we are speaking about two groups of persons. One, the persons at the very high end. Persons at the very high end, high income persons, generally gravitate towards the private system for their care. And persons at the lower end look to the public sector and very much support, especially for persons who are not easily reached by the public sector, persons go to the non-governmental organizations. When we are speaking about the total mix in the Caribbean, especially, remember, we are facing a COVID crisis alongside a crisis with non-communicable diseases. And to battle the two of them together, even if COVID comes to an end tomorrow, the NCDs will remain. And to a very large extent, when you look at the data, and especially the fatality data, and they speak about persons who have died because of comorbidities. Most of these comorbidities are literally related to your non-communicable diseases. So in this, you can't easily tackle non-communicable diseases, HIV, for example, ongoing infectious diseases. Now we have dengue fever in some of the countries that we have to grapple with. You can't easily speak to some of these unless you look at the health promotion, health education, outreach type of activities. And this is where you bring in the NGOs at the one end, and the private sector at the other end to make sure that persons with a higher income levels, for example, can get access, can be reached, can take all the measures. So I see going forward that mix. Related to all of that, of course, is the whole matter of funding. Even though public sectors may be poor, there are many private sectors which may be relatively well off. How do you tap into that source of funding from the private sector to support activities? And to an extent, you've had a lot of that taking place. The banks have gotten into the mix, the insurance companies have gotten into the mix. Some of the higher end Chamber of Commerce have got into the mix in terms of supporting some of the initiatives. You will need more of that going forward. In the health sector, particularly going forward, if you need to get new investment in equipment, supplies, then you will literally have to turn to the private sector. And to an extent, Jamaica has been taking the lead in a lot of this by having a doctor clinic, by having some of the non-communicable diseases services subcontracted to the private sector, for example, to get these things done. So I do see a major role, a major continuing role for both civil society and for the private sector in moving forward, not just with managing the COVID and COVID fallout, but with managing the continuation of diseases and conditions which are underlying in the Caribbean.
And I wanted to put the same question to you, Therese. What role do you see for civil society in the private sector in the coming months?
So I mentioned that it's all hands on deck, right? So we need collaboration from everywhere, partnerships from across the society. Stanley mentioned corporate responses. I mean, every day you open up the newspaper in Jamaica, some corporate is giving out care packages to X community. I think we've seen a lot of that all year long. And I think that's been super helpful because I think it has relieved some of the stress off of the government to provide support. And NGOs have been doing the same. So, you know, it's just the community spirit, the community desire to help other people. I think we've seen a lot of that on display this year. And I think it's going to continue. Stanley mentioned NCDs. I mean, basically Caribbean people die of NCDs but more than anything else. So that's been a complication, in fact, for all the deaths that we've had from COVID is because of the people who've had comorbidities. So that's been something that, I don't want to say this has been one of the positive externalities, but one of the positive externalities actually has been that ministries of health have talked about how important it is to be healthy, to move, to live a healthy lifestyle, because if you have diabetes, if you have hypertension, if you have, you know, cardiac, whatever, then get yourself in shape, because it would also help you, prepare you, and sort of immunize your body from catching the virus. So I think that those messages have been very much prevalent everywhere in Jamaica. I mean, the Minister of Health himself is always, you know, out running and posting pictures on Twitter about exercise and so on, and trying to get people to move. So I think that's been important. The fact that health has now become a major topic of discussion, whereas, I mean, everybody knew about NCDs, and we know about obesity, and we know about all these things that are unhealthy. But here now we have a real situation that says, look, this is the time for you to course correct and, you know, get moving and try to do something to help yourself. So I think that's been positive, and their NGOs have been helpful. Thanks.
Tim, I wanted to put the same question to you. In your experience, what role do nonprofits, civil society, and the private sector have to play in the crisis as it unfolds over the next year?
Yeah, I think a lot of the key issues have been touched on already by the other panel members. You know, in terms of healthcare, you know, depending on the setup in the country, the public-private partnership is critical, both in terms of on the public health response and making sure that there's the whole surveillance system includes the private sector, because sometimes they see cases before the public sector, and that linkage doesn't always work very well. So the overall surveillance response, having the ability to have, you know, surge capacity in the private sector if there's a need for treatment, so that you don't have to have all the ventilators or whatever else, and, you know, excess capacity in the public sector in case there is a crisis or the epidemic. We know in terms of reaching people, whether it's the long experience of the region in HIV/AIDS or outreach and communication, the civil societies, both in terms of NGOs that are specialized in health or support for the poor or vulnerable, or civil society like church groups or other organizations, have a critical role in communicating with people, because they have trust, they have networks, and have ways of supporting and reaching people. And so having the engagement of the entire civil society broadly understood is going to be important, both to emerge from this crisis, but also put the systems and collaboration in place to be well prepared for the next one.
Mm-hmm. And so thank you very much. And so the last question I have, and I put this to all of you, and it's a question we received from one of our audience members, is what role does the Caribbean diaspora community have to play in helping the region through this time? And I get.
Shall I start?
Go ahead, Therese.
I mean, because Jamaica has a very strong connection with its diaspora. So I think diaspora has been helpful in sending equipment back, doing, you know, health missions. I mean, that's sort of what they've been doing anyway. Mm-hmm. Obviously, remittances are extremely important right now. Stanley mentioned that remittances in Jamaica have been extremely robust. In fact, the last data point, I think it was August, 27% increase over 2019. That's extraordinary. Now, that may not continue if, as somebody mentioned, the U.S. support programs get cut off. But we've done some work on remittances to Jamaica in the past. I mean, a long time ago, even the 2008 recession. What has been extremely impressive to see is that remittances over time in Jamaica, like, it doesn't move. It's 16% of GDP. And that's, I mean, it's something I marvel over, because it speaks to the fact that there are families constantly moving abroad who continue to support their families back home. I mean, when I was at the IMF, we call this the constant love hypothesis, right? So people will continue to support their families back home, but still to see that number basically is what sort of padding the net international reserves right now is quite impressive. Now, whether that continues for the rest of the year we'll have to see. But I think that's been a huge lifeline for many people in Jamaica. So if all the diaspora people from Jamaica and the rest of the region who are in New York in this session, if you have families who can help, I think it would be welcome, especially as we know that in Jamaica unemployment just moved up from 7.6 to 12.6% at the end of July. So and that number is going to get higher as more data comes in for the rest of the year. So it's really important that diaspora keep supporting. Cash contributions help. I think they also send money. They send care packages. They send health equipment. They send all kinds of things. Jamaica has a strong diaspora network, and the question is always, what can we do more? I mean, should we have a diaspora bond? Are there other ways in which the diaspora can help? And I think, as far as the imagination goes, you can think of endless ways in which you can be supportive as that number of people living abroad grows. So I think it's enormously important for the region, not just Jamaica, but throughout. Haiti, Guyana, important. Remittances are important there as well. So yeah, just keep doing what you're doing. Thank you.
And I just would like to offer Stanley and Tim the opportunity to contribute any final thoughts. We only have a couple minutes left, so if there's anything else you'd want to add to this or any other issues we've addressed for this, just 30 seconds a minute, yes, that would be great.
Thank you, Desmond. COVID has really been a very trying condition to manage. But in the midst of all of that, I think that the Caribbean has had a chance to look inwards to a much greater extent than they had done before, and to look inwards to try to really come to grips with what are their strengths, what are their weaknesses and deficiencies. So it also provides an opportunity to reset, to rethink, so that whatever is planned for the months and the years ahead, we can be better off than what we were before. Because we keep saying we're going back to normal, but remember, normal was not really working for us in many respects. So rethinking that normal and making sure that we are better off, we are more productive, we're more equitable in terms of our sharing of the benefits of development. I think that's what we need to be gearing ourselves to. So it's a crisis, but it's also an opportunity.
And Tim, anything else to add? Final thoughts?
Yeah, first, just to thank the participants for the joining engagement. Since many are from the diaspora, I think this is a way of engaging, being informed. And of course, there's things you can do as an individual with your family. There's things you can do as part of an NGO or civil society group that has links back home. Increasingly, the opportunities to have folks from the diaspora be involved as investors or joining businesses because they know their country, they can partner with people locally. And certainly I think Therese mentioned early on this digital aspect, which is going to be a key priority. That as the digital revolution goes forward, that creates even more opportunities for information sharing, for collaboration, for business engagement, both for people in the region, but those that are still there internationally. And so having ways of maintaining that engagement is going to be critical. Obviously more to discuss. I saw a question about how to, possible career paths for working for international organizations. That would be a longer discussion, but I think just to stay engaged, stay committed, and just realize there's many ways to contribute. And appreciate everyone joining. Thanks.
Yeah, and so I wanted to make sure now that I thanked Therese, Tim, and Stanley for their really valuable contributions and for making this event possible, which is really important to our school community. And in discussing this important issue, I wanted to thank Karel Samuda, Lillian Bovia, and Elizabeth Ward for helping me think about who we should invite to this event. And I also wanted, of course, to thank Diana Lazal for all of her administrative support in organizing these events, these many events over the last year. Thank you so much. And I look forward to seeing all of you again in the next year. Happy holidays.
Thank you.
Bye, everyone. Take care.
Okay.